In this session, we are going to see details about forearm region, that to anterior compartment of forearm. I think you people are clear with arm and cubital fossa. So after that, we are going to reach in the region called forearm region. So that forearm region, same like arm region, it is also divided into two compartments as anterior and posterior. Same like arm, anterior compartment is called as flexor compartment and posterior compartment is called as extensor compartment. And then now we are going to talk about the flexor compartment of forearm region. So talking about flexor compartment of forearm region, we will be having muscles which are more massive than the posterior compartment muscles, that is extensor. Why? Because these are the muscles which are going to work against gravity, and so it is called as anti-gravity muscles. So flexor muscles, otherwise known as anti-gravity muscles, and in this forearm we have two divisions such as anterior compartment and posterior compartment. In that we are going to see about anterior compartment on the foremost. Okay, so now in the anterior compartment, the floor of the anterior compartment is formed by anterior surface of the radius and anterior and medial surface of ulna and the interosseous membrane which is present between these two bones. So if you remove all these muscles, all these muscles are covered by skin superficial fascia and deep fascia, and then we will be exposed with these muscles. So once you remove these muscles also, you will approach the bones present in forearm. In forearm we have two bones such as medial one we will call as ulna and lateral one will be called as radius bone. So those are the two bones which is going to form floor of the forearm region, and these bones are again united by a membrane called interosseous membrane. So together with this membrane, these two bones also going to form floor of the forearm region. So anterior aspect of this floor, we have the anterior compartment of forearm muscles. So about these forearm muscles we are going to see now. So before going into the details of muscles, you have to know how we can demarcate the parts such as anterior compartment and posterior compartment. How we can demarcate, we have to see. So talking about muscles of the forearm region in anterior compartment, the highlighted muscles, whatever you are viewing, everything will be coming under anterior compartment of forearm muscles. So here you can make out, you can remember this in orientation from lateral to medial. Or now you remember all flexor muscles are going to take origin from medial epicondyle of the humerus bone. Humerus, it is a bone present in the arm region, and this humerus will be having medial epicondyle and lateral epicondyle, and this is medial epicondyle. From the medial epicondyle we will be having origin of all the flexor muscles of the anterior compartment of forearm region taking origin. So here you can make out all the muscles are taking origin. To remember it better, you remember like from lateral to medial aspect we are going to remember the muscles, such as we are dividing these muscles in the anterior compartment into three compartments again. So in three layers we are getting this arrangement. One is superficial layer, then we have middle layer, later we will be having deep layer. So in superficial layer we will be having four muscles, in intermediate layer we will be having one muscle, and then in the deepermost layer we will be having three muscles present. Altogether we will be having 8 muscles comprising the anterior compartment of forearm region. So here from the lateral aspect to the medial aspect we will be having 4 muscles in the superficial area. So first muscle what you are viewing in the lateral side is pronator teres. So you can make out clearly this is the pronator teres muscle, so which is going laterally. Then after medial to pronator teres we will be having another muscle which we will call as flexor carpi radialis. So flexor carpi radialis, it is a muscle which is seen medial to pronator teres. From lateral aspect we are arranging these muscles which are taking origin from medial epicondyle of humerus. So first muscle what we seen is lateralmost muscle pronator teres, then we have flexor carpi radialis. You already know anterior compartment muscles are going to give an action called flexion, so we are calling those muscles as flexor muscles. So flexor carpi radialis, name itself it indicates flexion, Carpi in the sense it is going to insert in carpal bones. Then after radialis it is related to radius bone. Either attachment, that is insertion, will be happening in radius bone, so we are having this name called flexor carpi radialis. In anatomy, by the name of the muscles and bones only you can understand how it will be arranged. So if you are taking pronata teres, you know the action pronation is seen in our body. So that for pronation of the forearm region we have this muscle teres, in the sense rounded appearance we will call teres. We already have come across with this name in teres minor and teres major in the scapular region. So pronata teres is the first muscle which is used for pronation, and then we have flexor muscle, that is flexor carpi radialis. Later we have another muscle which we will call as palmaris longus. Here you can make out it will be having a small belly. Small belly will be seen for this muscle, and it will be having a long tendon for its insertion. So about the importance of this muscle I will tell you later. Now you just remember we have third muscle as palmaris longus. It is going to the palm aspect of the hand and it is getting inserted, and it is having a longer tendon, so we were calling as palmaris longus. And we will be having another muscle called palmaris brevis. So we have this differentiation as longus and brevis. Brevis means small. So palmaris longus, it is one among the muscle of anterior compartment of forearm region. Later, medial to palmaris longus, we have another muscle called flexor carpi ulnaris. You know, ulnar bone is seen in the medial aspect. So medial most muscle we are naming as flexor carpi ulnaris. So now you can understand better how the names are there. So first muscle what we seen in superficial layer is pronata teres, then we have flexor carpi radialis, palmaris longus, and then flexor carpi ulnaris. So once you remove the muscles such as flexor carpi ulnaris, radialis and palmaris longus, you can make out another layer of muscle present deep to it. So that muscle is nothing but flexor carpi superficialis or flexor digitorum superficialis, which is going to insert in the digits of the hand region. So in hand region we will be having 5 digits. So medial 4 digits will be having its muscle tendon coming from this muscle. So we are calling that as flexor digitorum superficialis, muscle for digits. So we are calling it as flexor digitorum superficialis because it is seen superficially. Just below the 4 superficial muscles we have this muscle called flexor digitorum superficialis muscle, which is a single muscle seen in the intermediate layer. So we have to view other 3 muscles which is present in the deepermost part. So we are removing these superficial muscles such as flexor carpi ulnaris, flexor digitorum superficialis and pronata teres. So if you remove all these 3 muscles, you have this part which you already know in cubital fossa we dealt, that is nothing but thickening of deep fascia. We have bicipital aponeurosis, so we are removing that also. Then we will come across with 3 muscles which are present deep. So those muscles are, first muscle which you are seeing is flexor pollicis longus. So it is going to make an action called flexion in the pollicis finger, that is thumb finger. In anatomy we will call as pollicis. So flexor pollicis longus. So longest muscle, it was the larger muscle. So we have another muscle for pollicis again, which is brevis, that we will deal later. In forearm region we have in anterior compartment flexor pollicis longus for the thumb finger. So it is present radially. You know, thumb finger is seen in the lateral aspect. So we have this lateral muscle called flexor pollicis longus. And another muscle what you are seeing is flexor digitorum profundus. Already we seen a muscle called flexor digitorum superficialis. So superficialis, it is seen in the intermediate layer. Profundus, always in the name itself it indicates deep. Profundus means deep. So deeper layer we have another muscle, and this is also going for digits. So we are calling this as flexor digitorum profundus muscle. So 2 muscle we have seen, one is flexor digitorum profundus and another one is flexor pollicis longus. Now we have to see another muscle which we will call as pronator quadratus. You know, we have seen a muscle called pronator teres in the superficial compartment or superficial layer. Now we have another muscle which is seen in the deeper layer, which will be quadrangular in shape. So we are calling this muscle as pronator quadratus. So this is the muscle which is known as pronator quadratus, which is one among the deeper layer muscles of anterior compartment of forearm region muscles. So these are the muscles you have to remember while talking about anterior compartment of forearm. And here you can make out many vessels and nerves present. So these are the nerves and vessels going to supply the anterior compartment of forearm region, such as we have brachial artery dividing into radial artery, which is going laterally, and then we have another artery present here which we will call as ulnar artery, so which is going medially. So these are the two vessels, major vessels supplying the anterior compartment of forearm region with its branches. And we have nerves such as, first nerve what we will be seeing is median nerve, so which is one among the branches of brachial plexus. So median nerve, it is coming from both lateral cord and medial cord. It is joining together and forming a single trunk called median nerve. So that nerve is going to supply the most of the muscles of the anterior compartment of forearm region. So then we have another nerve which is going to supply some muscles present here is ulnar nerve. So median nerve and ulnar nerve are major nerves responsible for the nerve supply of anterior compartment of forearm. Vessels which are related to this region are, one is radial artery and another one is ulnar artery. And these are the importance you have to remember. And here you can make out interosseous membrane. So this is the interosseous membrane, which is a connection between ulna and the radius bone. So this is radius bone and this is ulnar bone. Between the radius and ulna we have interosseous membrane. So which is going to form these three things, we're going to form the floor of anterior compartment of forearm region. Now we will see a detailed description about forearm anterior compartment. So if you take forearm, it is a region which extends from the elbow joint to the wrist joint. As like arm, it is extending from shoulder joint to elbow joint. We have the next part which is extending from elbow joint to wrist joint, that is forearm region. And the bones present in this forearm region are radius and ulna, as you know already. And these two bones are connected by a membrane called interosseous membrane. And here again in forearm region we will be having coverings such as skin, superficial fascia and deep fascia. So talking about the deep fascia of the forearm region, it is invested by deep fascia, that is antebrachial fascia. So you know in pectoral region we will call that as pectoral fascia, and the fascia present in arm region we will call as brachial fascia. Here we are calling with a name called antebrachial fascia. And at cubital fossa, the same fascia, it is having a thickening like appearance. So that fascia we will call as bicipital aponeurosis, which we already seen. It is nothing but one among the insertion of biceps brachii. And now again close to the wrist region, again we will be having some sort of thickening in the deep fascia, and that thickening we will call as flexor and extensor retinaculums. So we have flexor and extensor retinaculum near to the wrist joint, and in the cubital fossa we have bicipital aponeurosis, and all over the deep fascia present in forearm region we will call as antebrachial fascia. Now talking about flexor retinaculum, the thickening present in the anterior aspect of wrist joint. So this flexor retinaculum, it crosses over the carpal bones. As seen in the first picture, it is going to cross over the anterior aspect of the carpal bones. And the attachment if you take, so we have medial and lateral attachment. So where pisiform bone, see you have ulna here, this is radius. So ulna side, this is medial aspect and this is radial aspect. So here we have carpal bones such as pisiform and hamate. So these are the two bones which is giving medial attachment to flexor retinaculum. Same way we have lateral attachment that is happening in two other bones, that is scaphoid and trapezium. So this is the scaphoid bone and this is trapezium. So these are the four bones responsible for the attachment of this flexor retinaculum. So the function of this retinaculum is, the underlying the flexor retinaculum we will have a space, so which is bounded by carpal bones. So we are having a structure forming like tunnel. So we are calling this as carpal tunnel. Carpal tunnel, the appearance we get by the formation of the carpal bones which is lying below to form a depressed area we will call as tunnel, carpal tunnel. So they talking about the structures passing through this tunnel, that is below the flexor retinaculum. We will have major structure, that is median nerve, and then we have tendons of flexor digitorum superficialis. Here we can make out, so this yellow remarked area we will call as median nerve, and just below that we will have tendons of flexor digitorum superficialis, and below that we will be having again tendon of flexor digitorum profundus. So these are the two arrangement. One is superficialis, one is for profundus. And then we have another tendon which is present laterally, which we will call as tendon of flexor pollicis longus, and one more tendon which is present is that is flexor carpi radialis. So these are the important structures which are going to pass deep to flexor retinaculum, that is in the carpal tunnel. And then moving on to the compartments of forearm region. This compartment of forearm, we have anterior flexor compartment and posterior extensor compartment, same like arm region. So talking about how it is divided, the limiting medial and lateral border of this flexor and extensor compartment are not crossed by any motor nerves. So it is safe to dissect in that region to make out the extensor and flexor compartments separately. The anterior compartment is called as flexor compartment, posterior compartment is called as extensor because of its action. And one more thing you have to remember is, if we are tracing out medial and lateral border for these compartments, these borders are not crossed by any motor nerves which are supplying for muscles, so it is very safe for us to dissect through that borders. Now coming into contents of the anterior compartment of forearm, we will be having some muscles and arteries such as radial and ulnar arteries, which are branches of brachial artery, and then we will be having nerves, median and ulnar nerve. Median nerve which is coming from both medial and lateral root of brachial plexus, lateral cord of brachial plexus, and then we have ulnar nerve which is coming from medial cord of brachial plexus. And then we will be having all the muscles supplied by median nerve except flexor carpi ulnaris and medial part of flexor digitorum profundus. Except these two muscles, we will be having all other muscles present in anterior compartment supplied by median nerve. So these two nerves which are exception are supplied by ulnar nerve. Now talking to details, coming for the details of this anterior compartment muscles. First we will name all these muscles, such as we will divide into three groups: superficial, intermediate and deeper group. Superficial group, we are naming the muscles from lateral to medial side. So first muscle what we will see is pronator teres, pronation, and it is rounded in appearance, so we are calling that name as pronator teres. And then we have flexor carpi radialis medial to this pronator teres, so which is going to give an action called flexion, and it is present related to carpal bones, and then it is going related to radius. Then we have palmaris longus, which is going to palmar aspect of hand, and it will be having longer tendon. Then we have flexor carpi ulnaris, which is going to the ulnar side of the forearm region. Then we have intermediate muscle, which we will call as flexor digitorum superficialis, which we deal before. And then we have deep group muscles, which are again three in number. Those are flexor pollicis longus, flexor digitorum profundus and pronator quadratus. So altogether in anterior compartment we have 8 muscles. So in superficial group we have 4 muscles. In intermediate group we have only one muscle that we will call as flexor digitorum superficialis, and the deeper part we have 3 muscles. One is flexor pollicis longus, flexor digitorum profundus and pronator quadratus. Now we will look on to the details of each muscle. So now going for the importance, like superficial group of muscles and intermediate muscles, it is going to possess a common tendon of origin. That is, origin of all these muscles are taken from medial epicondyle of humerus, and so it is going to cross the elbow. So it is taking origin from medial epicondyle of the humerus bone, and all the superficial and intermediate muscle are taking origin in such a way, and these muscles are going to cross from medial to lateral aspect. Coming to deep muscle, all these deep muscles are taking origin from radius and ulna. Now moving into details of these individual muscles. First muscle what we are going to see is pronator teres. So origin from the above bone, that is from humerus, and also you can see a small twig of muscle taking origin from forearm bone, that is near to ulna. So we have pronator teres taking origin by two heads. So one head it is taking origin from humerus and another head taking origin from ulna. Two heads of origin will be seen. So humeral head it is taking origin from medial epicondyle of the medial supra and also from the medial supracondylar ridge. So this is the medial supracondylar ridge. So from there also some fibers are taking origin along with medial epicondyle of humerus. Now coming to ulnar head, it is taking origin from coronoid process of ulna. So if you know the features of bones clearly, all these attachments is very easy for you to remember. Talking about insertion, the insertion of pronator teres, it is going to happen in the middle of the lateral aspect of the shaft of radius. So from medial to lateral, this muscle is passing. Nerve supply of this muscle is by median nerve. The action of this muscle is mainly, as the name it indicates, pronation. And along with pronation, it is going to make an action called flexion of forearm. So two actions it is going to make. One is pronation and also flexion of the forearm region. Now going to second muscle, that is flexor carpi radialis. This is the second muscle of the anterior flexor, anterior compartment in superficial layer. So origin of this muscle, it is from medial epicondyle of humerus. Here you can make out this is radialis muscle. It is taking origin from medial epicondyle and inserted into the, and if you make out, the name itself indicates it is carpi. So it is crossing the carpal bones. After crossing the carpal bones, it is getting inserted into base of the second and third metacarpal bones. So this flexor carpi radialis taking origin from medial epicondyle of humerus, and the tendon runs through ossifibrous synovial lined tunnel formed by groove on trapezium. So here we will be having that tunnel which we will deal later. So that tunnel it is going to transmit this tendon and getting inserted into the base of second and third metacarpal bones. So origin from medial epicondyle of humerus, insertion into metacarpal's base, that is second and third metacarpal bone. Nerve supply of this muscle is by median nerve. The action of this muscle mainly is flexion, and along with that it is going to abduct the hand at wrist joint. So flexion in the forearm region, abduction of the hand in the wrist joint region. Near to wrist joint we will be having abduction made by this muscle. So this is all about flexor carpi radialis. So talking about the third muscle, that is palmaris longus. Origin same like all other superficial muscle, it is taking origin from medial epicondyle of humerus, insertion into the flexor retinaculum which is present here over the wrist joint, and also it is going to form an extension and making in the aponeurosis called palmar aponeurosis, that is thickening of deep fascia in the palmar aspect of hand region. So this is the insertion of the palmaris longus. Origin from medial epicondyle, insertion in the palmar aspect by making palmar aponeurosis. Nerve supply again same median nerve. Action flexion of the hand at wrist joint. Main action of this muscle is flexing the hand at the wrist joint. Now talking about flexor carpi ulnaris. So this muscle if you are seeing, you can make out clearly in the previous image, that is it is taking origin by means of two heads. Flexor carpi ulnaris, it is taking origin by means of two heads. One is humeral head and ulnar head. You have to remember we already had seen on muscle with the same feature, that is taking origin by two heads, that is humeral and ulnar head, that is we seen in pronata teres. Same way we have this muscle called flexor carpi ulnaris. It is taking origin from humeral head by means of common tendon, that is from medial epicondyle, and from ulnar head it is taking origin from olecranon and posterior border of ulna. In ulna we have a process called olecranon process. That process along with posterior border of ulna, both the things are giving origin for this muscle. So flexor carpi ulnaris, it is again having two heads, humeral and ulnar head. Humeral head taking origin from medial epicondyle, ulnar head taking origin from ulna's olecranon process and posterior border. Now talking about insertion, it is forming a tendon and getting inserted into medial most carpal bone, that is pisiform bone, and then by pisohamate and pisometacarpal ligament they gain attachment to hook of hamate also. Along with that it is getting attached to the base of fifth metacarpal bone. So insertion, first it is getting attached to pisiform, later it is going to gain its attachment to hook of hamate along with base of fifth metacarpal bone. Talking about its action, it is making flexion along with adduction of the hand at rest. Carpi radialis, it is going to possess abduction. Here we have adduction happening in the hand by means of flexor carpi ulnaris. Nerve supply, name itself indicates it is the medial side muscle, so obviously nerve supply is ulnar nerve. All other three muscle what we seen is supplied by medial nerve. This is the one exception muscle which is seen on the superficial layer, that is ulnaris, which is supplied by ulnar nerve. Talking about intermediate muscle, that is flexor carpi superficialis. Origin of this muscle is again by means of two heads. So one is humero-ulnar head and another one is radial head. Humero-ulnar head, that is by taking origin from medial epicondyle by means of common tendon, and also from ulnar collateral ligament and also coronoid process of ulna. From humerus we have medial epicondyle giving its origin. Along with that fibers are extending towards the ulnar collateral ligament, and also it is taking origin from coronoid process of ulna. Now we have another head, that is radial head. So radial head, obviously it is taking origin from radius anterior aspect. In the anterior aspect of radius we have a line called oblique line. So that oblique line, it is giving origin for this radial head of flexor digitorum superficialis. So this whole way it is getting origin. So origin from humero-ulnar head and also from radial head. And a fibrous arch is connecting the two heads, and between that we have transmission of median nerve and the ulnar artery. A fibrous arch will be connecting these two heads, and between these two heads we will be having passage of median nerve along with ulnar artery. Then we have insertion of this muscle. Insertion, the muscle ends in four tendons, as we call this as digiti. We have four tendons, one each for medial four digits on sides of the middle phalanx. So medially we have four fingers which is getting its insertion by flexor digiti superficialis. So at rest these tendons are arranged in two pairs. Superficially we have middle and ring fingers tendon, and deep we have index and little fingers tendon, and these tendons pass deep to flexor retinaculum, which is enclosed with a common synovial sheath. So that's all about the insertion. So compared to all other muscle, flexor digitorum superficialis has different type of insertion which you have to remember. The insertion by means of four tendons, and it is getting inserted on the sides of the middle phalanx, and then at the wrist what is happening is we have two layers formed by this tendons while passing. And superficial layer we have middle and ring fingers tendon, in deep layer we have index and little fingers tendon. So these tendons while passing below the flexor retinaculum will be enclosed with a common synovial sheath, and opposite the proximal phalanx the tendon splits into two, and then again it will join together, and later again it will split into two and gets inserted into the sides of middle phalanx. Then insertion of flexor digitorum superficialis you are seeing here. So this is flexor digitorum superficialis. It is splitting into two and later it is getting inserted into the middle phalanx. So in the proximal part it will split and later near to the head of the proximal it will unite. Later again it will split into two. After splitting it is getting inserted into the sides of the middle phalanx. Now coming to the action of flexor digitorum superficialis. It is the main flexor of proximal interphalangeal joint, and secondarily it may flex metacarpophalangeal and wrist joint. The main function is flexion of proximal interphalangeal joint. So this is the interphalangeal joints which they shown. So these joints will get flexed by means of this muscle, and also sometimes it will flex the metacarpophalangeal joint, that is this area, and also the wrist joint to flex. So these are the secondary function, the flexion of wrist joint and the metacarpo-interphalangeal joint, and the remaining interphalangeal joints are the major function which is causing flexion in these joints. Talking about flexor digitorum profundus, that is one among the deeper layer muscle. So name itself it indicates profundus. Profundus means deep, you have to remember. So just below the flexor digitorum superficialis we have flexor digitorum profundus. Origin of this muscle, it is taking origin from ulna. So in ulna, upper 3/4 of ulna, it is giving origin for this flexor digitorum profundus, that is including its anterior surface, medial surface and posterior border. So these are the three areas giving origin for this particular muscle. So flexor digitorum profundus, it is wholly taking origin from ulna, that is from medial surface, anterior surface and also from the posterior border. It is also taking origin from olecranon and coronoid process of ulna and also from the adjoining interosseous membrane which is present between the radius and ulna. So these all about the origin of flexor digitorum profundus. Now talking about the insertion of this muscle ends in 4 tendons for medial 4 ridges. Same like flexor digitorum superficialis, we have this muscle also ending up by forming 4 tendons, and that is also for medial 4 digits. Here what will happen is these tendons also going to pass deep to the flexor retinaculum below the flexor digitorum superficialis, and it is going to perforate the flexor digitorum superficialis. Later it is attaching to palmar surface of base of distal phalanx, where attachment for flexor digitorum superficialis is happening in the middle phalanx on the sides. So here we have base of distal phalanx giving the insertion for this particular muscle to the digits. So then talking about the action of this muscle, the major action is flexion of the distal phalanx. We will be having distal phalanx giving attachment for this particular muscle. So action also happening in this distal phalanx, that is flexion of the distal phalanx. Moving into next deeper muscle which we have is flexor digitorum flexor pollicis longus. So pollicis in the sense, as I said before, it is a muscle for thumb region. Anatomically we will call it as pollicis. So this flexor pollicis longus taking origin from the anterior surface of shaft of the radius and the adjoining interosseous membrane. So flexor pollicis longus taking origin from anterior surface of shaft of radius along with the adjoining interosseous membrane. Later insertion is happening in the palmar surface of base of the distal phalanx of thumb. So this is a muscle going to be getting attached to the thumb region, so we are calling it as flexor pollicis longus, because the main action for this muscle is flexion of the pollicis finger. So insertion also happening in the pollicis finger, that is in the distal phalanx of thumb we will be having insertion of this particular muscle. Origin from the radius, that is anterior surface of shaft of radius giving origin for this particular muscle, and then we will be having interosseous membrane which is adjoining this bone also giving attachment for this particular muscle. Later it is forming a tendon and passing anteriorly towards the thumb finger. There in the distal phalanx it is getting inserted. Talking about the action will be flexion of distal phalanx of the thumb. Along with that, continued action of this may flex proximal joints crossed by the tendon. So the continued action of this flexor pollicis longus may flex proximal joints crossed by the tendon also. So I'm talking about the last muscle present in the anterior compartment of forearm, that is deeper muscle, we will call that as pronator quadratus because of the shape, quadrangular shape. So pronator, in the sense, the major function of this muscle will be pronation. The origin of this muscle, it is by taking origin from oblique ridge on lower 1/4 of anterior surface of shaft of ulna. So from the medial aspect it is taking origin, that is from the oblique ridge in the lower 1/4 of the anterior surface of shaft of the ulna, and then it is getting inserted laterally, that is by forming two fibers. One is superficial fiber and the one is deep fiber. Superficial fibers, that is lower 1/4 of the anterior surface and anterior border of radius. It is giving insertion for this particular muscle. So insertion, it is happening in the lower 1/4 of the anterior surface of radius, and then deeper fibers, it is getting attached to the triangular area above the ulnar notch. Ulnar notch is seen in radius bone. So here you can make out this is radius. So here we will be having medially ulnar notch. Above the ulnar notch you will be getting a triangular area. That triangular area giving insertion for this deep fibers of pronator quadratus. Action of this muscle is main pronator of forearm. So the action of pronator quadratus is pronation, and then it is going to pronate the forearm region. So these all about the muscles present in the forearm region in the anterior compartment. So here you can make out a summary like superficial group. First four muscle what you are seeing here is pronator teres, flexor carpi radialis, palmaris longus, flexor carpi ulnaris. Then we have intermediate muscle, that is flexor digitorum superficialis. Once we remove these all muscle, that is 5 muscles, you will approach the deeper group muscle. So which is present laterally, we will call as flexor pollicis longus. Then we have flexor digitorum profundus in the medial aspect. If we remove these two also in the lower aspect, that is in the anterior surface, lowermost part, we will be having another muscle called pronator quadratus. So the another important thing you have to remember here is these muscles are covered by a sheath, which is a thickening of deep fascia again. That sheath we will call as fibrous flexor sheaths. So above this fibrous flexor sheaths, from the head of metacarpal to the base of distal phalanx is present a strong fibrous sheath. So this fibrous sheath is mainly present from the head of the metacarpal to the base of the distal phalanx, and then it is going to hold the flexor tendons in position. So thus we will be getting some bow-like bowstring like appearance when we extend our hand region. So this is attached to the sides of the phalanx. At last it is ending by attaching in the sides of the phalanges. These fibrous flexor sheaths are taking origin, or it is extending from head of the metacarpal to the base of the distal phalanx, and then these are the sheaths which is going to hold the flexor tendons in position, and it is attached to the sides of the phalanges, and then a tunnel is formed. That tunnel is formed by the sheath and anterior surface of phalanges and also by interphalangeal joints. So a tunnel is seen in the hand region anterior surface, that is formed by this sheath, anterior surface of phalanges and interphalangeal joints, and these flexor tendons and synovial sheaths of finger lie in this tunnel. So whatever sheath along with the tendons are going to lie inside this tunnel region. So this is the fibrous flexor sheath which you are seeing. So this is called as a tunnel. This is tunnel, and here we have tendon covered by fibrous flexor sheaths. So synovial sheaths of flexor tendons you have to know. So these are nothing but long flexor tendons of fingers are again enclosed by a common synovial sheath, and it has two-layered arrangement as though synovial sac is invaginated by tendons. So this tendon is going to be present, and this tendon is invaginated by the synovial sac. That type of appearance it will give. So it will be having two layers, and then we'll be having vincula longa and vincula brevia, nothing but synovial folds which are going to connect the tendon along with the phalanges. So vincula longa and vincula brevia are nothing but synovial sheets which are formed as synovial folds, and these folds are the major thing which is connecting the tendons to the phalanges, and these going to transmit vessels to the tendons. So here in this picture you can make out, so vincula longa and vincula brevia. So here you can see vincula longa attached to flexor digitorum superficialis and profundus, and here also you can see some fibers that is related close to the pharynx and the tendon, so which is smaller, which we will call as vincula brevia, and these are larger, so we are calling that as vincula longa. So here in this picture also it is clear. So vincula longa are synovial folds extending from flexor sheets to the phalanges. So the tendon and the phalanx will be connected by these longa and brevias. So this is brevia, which are smaller. So that's all about the features seen in the anterior compartment of forearm. So anterior compartment of forearm will be having muscles, vessels along with nerves. So about the nerves detail we will see later. Now muscles, I think you people are clear. Now we will move on to extensor compartment. After finishing all those things about the muscles, we will move on to each nerve separately. So moving on to the forearm region, extensor compartment.